Welcome to another video on the series of healing depression. In this one we talk about body. The body is indeed the center of the self, because we may say as a self we are body and mind, and beyond that some spirit. But what is actually touchable, visible, is the body, what we refer to as the body. And in the area of depression, what is obvious is that the body has symptoms and they are measurable. So we may lose weight, we may have a higher heart rate time to time during depression and depressive episodes, and we may feel weak, we may be tired, low energy, and these things are sensations in the body. So what we can do to bring body to a higher level of energy and energy circulation. So the first thing to talk is that we have this dynamic of the body, that it needs to be strong. So the body needs to be fit. So either we are any illness or not, if we are trying to recover, or if we are just doing the routine way of life, the body needs to be strong and fit. So the muscles need to be strong, the bones, the blood circulation, and fluid circulation, and energy circulation, oxygen circulation, it should be regular. Usually during depressive episode and during the long term of depression, one thing that is very common among the people experiencing this mood is that the body is not fit. So it's either having some injury, or we forgot that doing exercise is the essential part of having a healthy and high energy lifestyle. So many times the first question in front of the person going through depression is that, do you do exercise? And often the answer is no. So usually people who do exercise are less involved with low mood and low energy, and they are more motivated and more forward toward the new days and new adventures and new excitement, because exercise opens up not only the body in terms of energy, but also opportunities to go forward. It brings energy and it brings appetite, and it wants to have food after the exercise. So if you are not doing exercise, the first thing suggested is to start exercise. Then the question is exercise and movement. What kind of exercise we should do? So any sort of movement is good, starting from walking if you are not used to exercise. So gradually building up to more weight and muscle training. The more you go, your body is more resilient and more the energy is accumulated. So more circulation, more the veins start to work, the heart start to have a different heart rate, because of the overtime it changed the pattern of how the body and metabolism work. So if you have not started yet the exercise, if exercise has never been a part of your life, it's now time to include it. And if you have any kind of injury, try to do an exercise that doesn't get involved with your injury. For example, many of us suffer from foot or leg or knee injury, and often it's very much the case that we are also involved with chronic pain in certain part of the body, which is also triggered by nervous system during a depressive episode. So many of us have lower back pain, many of us suffer from ankle and knee and also shoulder and neck. So what is here is that we need to gradually strengthen our muscles. So we need to do Pilates exercises like yoga poses, and sometimes if we can, very lightweight weight training, weight lifting. And if weight is a challenge body, we can use the weight of the body like pull-ups, some push-ups, some sit-ups, and each of them, if we have pain, we just can either skip those that are painful or replace them with some easier ways, easier version of that exercise. So there are so many types of doing things with the body that you can usually replace it with another position or a variation of the exercise. So another thing that is very important for the body is the oxygenation. So oxygen is indeed the invisible side when it comes to body and what body actually needs. So oxygenation often comes through cardiovascular training, and it involves like movement, exercise, lifting, doing things with some engagement of heart rate. So heart rate means having a higher rate of heart rate above, for example, 120 per minute during the day, at least for a few minutes. So it's much better if we do it in the morning before starting any kind of mental activity, going for any kind of exercise that will engage our heart rate above 120. And if we reach a few minutes of 150 in which we start sweating, then indeed our body start to get to a higher level of circulation, both in terms of blood circulation and oxygen circulation, and it reaches the ultimate, the foremost organs of the body that are, for example, in the head. And mental illness involves the nervous system, which the biggest part in the brain, and it's the highest part of the body, and because of the gravity is the highest level and the more probably difficult to get the blood and oxygen there. So higher heart rate also encourage the blood and the oxygen to reach all these veins and organs. So getting oxygenated all these organs is really an important part of depressive episode to reverse it. And not only for a depressive episode, for every day of normal life, this is essential to oxygenate the body. So a few times a day. If we have hard time with movement, we have a substitute. We can do cold shower or ice bath. So this way also the body start to activate and the heart rate goes high, again 120, more we stay 150 and more. So the body starts getting vibrant. Vibrant means the heart starts to beat higher, and oxygen starts to flow. And it also brings a lot advantages. So it regenerates many of the cells in the body, and it also is boosting the immune system, is anti-cancer, and so many other advantages for the body. And plus, we can also do breath work exercises. So if we look into all the school techniques from yoga, pranayama, there are different techniques, different patterns of breathing, like very fast breathing or deep breathing. So these also indeed perform cardiovascular exercise. Only case different is that if you have a joint pain, for example, if you have a knee pain or ankle injury, you really don't need to run or walk or lift. You just sit or lie down and do the breath work. So you change your pattern of the breathing by only using the abdomen. So by only making the abdomen tense and leave it, we can already get a lot of benefits of cardiovascular and oxygenation of the body. So oxygenation and circulation is another element beside exercise. And the other important thing about body is the rest. So we need to let the body rest. We need to have a time dedicated to body in which we don't involved with anything, and the body has the time to regenerate and reverse back to the restful state in which the organs start to regenerate themselves. So these days there are a lot of distractions, especially with the screen, with TV, with radio. We think that we are resting, but at the same time we are watching TV or watching news or watching movies or reading news or on the phone watching so many things. So this lifestyle is making us a bit far from the full version of rest, in which we close our eyes, stop hearing and get talking, and then we just let the body be. Even if we are not sleeping, the body is not involved emotionally anymore, because when we are watching, when we are reading emotional matters, emotional content, our body is indeed producing hormones emotionally, and especially nervous system is involved. So it's important to have dedicated time for the rest. Even if we are not sleeping, we can close our eyes and disconnect, so this way the body has time and space to regenerate and come back to the restful state. So sleeping, circulation and oxygenation, and exercise are the three important activities that we need to include our daily life, a weekly life, to heal our body in the course of getting more motivated, more energetic, and heal any sort of lowness and what's so-called depression. So take care of your body, eat well, sleep well, exercise well, and oxygenate.